Hello, Cricket Matters fans. Welcome back to another exciting episode of the Cricket Matters podcast. And oh boy, do we have a spectacular treat for you today. As you settle in, hopefully you settle in comfortably, whether it's on a walk, in your car, or even down the ground or in the nets. Get ready to have your world rocked, your knowledge expanded, and your perspectives shifted. He is the man who can bow down to his expertise, a titan in the field of human performance and movement strategies, and a master in the art of eliminating pain at its roots. He hails from the groundbreaking realm of StopChasingPain.com. And no, he's not a superhero, but he might as well have a cape and an emblem because he's out there saving lives one pain-free client at a time. More than just a doctor, he's a trailblazer, an educator, and has a system of training that's transforming lives and bodies across the globe. A man who doesn't just treat pain, but fundamentally changes the way we understand and approach it. He's got the key to unlock that's been holding you back from a pain-free life. Ladies and gentlemen, fasten your seatbelts, grab your notepads, because it's not just a conversation, it's a journey into the world of human potential. Here to give us a masterclass on how pain, and particularly back pain, works, and most importantly, how to stop chasing it, please put your hands together and welcome the dynamic, the brilliant, the life-altering force that is Dr. Perry Nicholson. Perry, welcome to the Cricket Matters podcast.
Wow, holy cannoli, man. That's the best intro I've ever had in my entire life. I better be good. Oh, thank you. I'm going to have to get the recording and play that back for my wife whenever I need that when I'm in trouble.
You are so well. Literally practicing that. Got that ready for the last half an hour. So for those who've never heard the Strength Matters podcast, which is our sister podcast, Perry is a dear friend of the show, and it's absolutely awesome to have him back. We go a long way back. Right, but it's been about time we got him onto the Cricket Matters episode show, because there's so much knowledge he can share and share with us along the way. So,
genuinely, thank you. That's so kind of you. Thank you, my friend.
You're welcome. I love it. Now, if you hear his funny accent, he is American, and he'll tell us a little bit more about himself in a second. But Perry, as always, the first question we always ask on the Cricket Matters podcast is, Perry, why does cricket matter to you?
That's a great question. I've never been asked that before. and I'll be the first to say, because I'm in America, I don't really follow the sport. But one of the things that I love about it is, one, it's involving a lot of what I love to talk about and love to do myself, and that's just movement, human movement. And I love the passion that people have for cricket when they love cricket. It lifts you up in so many different ways, from mentally, physically, emotionally. That's a win. That's a win.
I like it. You can have that, and it is so funny because, like, every time I've been in the States and spoken to people about cricket, they don't quite know what it is, and they go, "Is that similar to baseball?" And it is similar to baseball, and you do know baseball, which is a big thing. So I think on that note, tell the world, because obviously I know who you are. The Strength Matters audience knows who you are, but the world of Cricket Matters have no idea who you are, Perry. So for those who've been hiding under a rock when it comes to human movement and pain, can you tell them a little bit about yourself and what it is that you do?
Yeah, I'd be happy to. Well, Stop Chasing Pain is the name of my brand and my company, and it's honestly my life's mission. And it means this: we treat pain, but we don't chase it. And chasing it means that people typically go after where somebody keeps pointing to where it hurts. They point to the shoulder, they treat the shoulder. They point to the hip, they go to the hip, and then they're all over the place, right? So we need to look at the entire body, the entire human being that's standing in front of you. And that's my mission right there, is to teach people to start where it hurts and then learn how to look everywhere else. So I've been in healthcare at this point, I think, close to 30 years, which is really hard for me to actually say that number. But it's been a lot of learning along the way. It's where you're forever a student, and you're always learning.
I think obviously the company name is Stop Chasing Pain. It's a mantra that I've adopted as well over the years, and I explained to so many athletes and guys I work with here around cricket. I go, guys, that pain is just a symptom. It's not where the problem really is most of the time. So I go back to stop chasing pain. Can you tell the story about how you come up with the name Stop Chasing Pain and why it means so much to you?
Oh, yes, I'd be happy to. Well, I got the name from my mentor, who you probably, I know you've had on your podcast and you talk about, and his name is Gray Cook, who's a brilliant physical therapist who completely changed my life and shifted the way that I look at everything, honestly. And I went to one of his workshops that he did many, many years ago. And I was sitting in the audience looking at a presentation on the slides. And it was a white screen there with nothing on it. And then 3 words showed up, just written in bold red. And it said, stop chasing pain. And it just hit me right there, because one of the reasons I was at that workshop is I was very frustrated in my clinical practice and in my life. I was very close to giving up the profession because I felt like that's all I was doing, was just going after the side of pain, and all of these different courses and techniques that I was taking were just telling me and showing me how to do different things to the side of pain. But it wasn't working. People kept getting the pain, and it kept coming back. And I said, I'm missing something here, and I don't want to continue doing this. And then once those showed up, it was like everything in the universe lined up that I was supposed to meet him. I was supposed to be there. And then the funny part is after that, I honestly stopped listening to the presentation because I jumped on my phone and I did a Google search on GoDaddy.com to see the StopChasingPain.com been taken yet. And then right then and there, I had secured the name. And then afterwards, I said, hey, is it okay if I use that name? So it's like, you do it and then you ask for forgiveness later, sort of thing.
Brilliant.
And he's like, absolutely. And that was the moment that my world completely flipped. And then sharing that perspective with everyone of all different levels, not just in healthcare or athletics, but everyday people. Because, pain is something chronic pain is something that so many individuals are suffering with.
Absolutely. And I got to caveat this as well, because before this turns into too much of a bromance, that whilst Perry's on the podcast, I can contribute, I'd reckon, about 60% of my learning when it comes to health and fitness to Perry directly. And the work we've done together, and mentorship he's done with me in seeing things differently. And we've worked together and collaborated on so many different things over the years. But that's the thing that was missing for us. Is like in the world of S&C and personal training, and like that gap with, and I've obviously got physical therapy, physiotherapist, osteopathy, and chiropractic on one side. There's this gap in the middle that a lot of people don't understand. And you need both worlds, but you need people to understand the bridge between the two. And you help me connect those dots between the two. So it allows me to look at athletes in such a different way now. Like you say, you talk about movement, stop chasing pain, all these type of things. Like, wow, I see things in different ways. So that's a big hats off bromance type thing to you, Perry, for like getting me into this world. So what you've learned from Gray and everything else and passing on to us, it's been wonderful. And it's completely changed the way we program and change athletes for the better. And this is why I wanted to get you on here as soon as possible, because I think the world of cricket needs to hear what you have to say and the approach we're having to pain, because it's very different to what's out there at the moment.
Yeah, well, first of all, thank you so much. I mean, I love a good bromance anytime. And well, one of the biggest things that changed when I met him was, up to that point, I was never looking at movement. Mm-hmm. I was a clinical person, and I'm just looking at anatomy and body parts, and I'll put you physically on a treatment table and do stuff to you there. But people don't live on a treatment table. They got to get up and move and walk and then play their sport. So I never even took the time to look at movement. If I did, it was isolated. Let me see you try to move your knee that hurts. But I didn't pay attention to the rest of the body for one reason. They weren't pointing to the knee. That was my biggest mistake. Then it's actually just simple. Well, let me look at everything else that doesn't hurt. How about that?
Yeah.
And you're probably going to find a lot of issues in those spots because the body can only pay attention to one pain at a time. And it'll typically be the one that's the greatest for you, or one, honestly, that holds the most emotional baggage for you that you're going to pay attention to. So just that shift in and of itself. And then it was a perfect collision for me, honestly, because I've been athletic my whole life. I started training and bodybuilding in the golden era before anybody really knew what it was at the time. This is like 1980. And I've been into health and fitness and personal trainer certification. And I never thought that the world of health and fitness over here could intermix with the medical over here. Because at the time, they were just polar opposites. Now everybody's like, well, of course you would. But they blended together so much. And then that's when I made my way back into concentrating a lot with athletes that do over and over and over stuff that they love to do, the repetition of all different types, right? Whether it be cricket or baseball or whatever, because the people who love their sport, they do a lot of that sport.
Yeah,
right.
And they want to do it and keep doing it, even though it's sometimes playing through pain. As an example, it's
that's part of being an athlete, man. I mean, some part of that's that gridiron, suck it up until you get through it kind of thing, because you can worry about it later once you win. I get it. But you also want to make sure you can keep winning, not just one. You got a career after that.
Yeah, no, exactly that. And this is kind of why I wanted to bring you on. So I'm going to talk about, obviously today is all about addressing back pain in cricketers. Like, I think back pain is one of those common problems, not just in cricketers, but in athletes and general people around the world. But particularly in cricketers, it is very much at the forefront of the spotlight, particularly at the elite level, because lumbar stress fractures in fast bowlers, they're pitchers in our world, Perry, are still the most prevalent injury in the sport of cricket at the elite level. But they're happening lower down too, and a lot of younger people having. And obviously, in cricket, there's a lot of the majority of injuries are of non-contact nature, and they're traditionally thought of as overuse. But this is why I want to get down the rabbit hole today, because back pain in not just elite cricketers, but everyday cricketers on the weekend warriors who are playing, they're struggling to move the next day. They're playing through pain. They're taking painkillers, sometimes injections too, which I'm starting to realize. So, with everything that you know, let's talk about back pain as a general term. We'll bring it down to baseball and cricket in a second now. So, from your experience, right, what is the basic anatomy of back pain? What happens in back pain? What starts things off? What gets the ball rolling from what you see? I know it's very general, but we'll go more specific in a bit.
Yeah, I'll try my best, because that's one of the most complicated questions in the world. That's like asking about who created the universe, and I'm not kidding you. Because that's a good point, though. Everybody's got their own opinion on it, honestly, and their own take. And I don't really quote research too much, because we have a lot of research right now, but back pain is going up, not down. So the more we know about the back, the more people get pain. So what does that tell you? It's probably not to do with just the back. And it doesn't, because the body is one piece. You can't break it into individual parts. And that's the first mistake that I see when people have a back injury. But, you have to start somewhere. So start with the back. And if you treat it and it gets better, well, that's awesome. It should. But my question next is, does it stay better or not? If you have to keep going back to it, very rarely will X marks the spot. Sometimes it is, but especially if it's a non-contact, non-traumatic injury. I'm going to tell you right now, there's no way in the world it's coming from the back. It's coming from everything else that's working with the back. It just ends up in the back. Right? Because there's so much to go with an anatomy in the back, from the muscles to what they call fascia, which is the connective tissue, the blood supply in and out, what they call lymphatics. Can you get rid of the waste around the back that you used all day long? Right? And then, of course, you have the spine and the alignment there. But this is where it gets so tricky, because you can have a person who has a back on an examination where they've got arthritis, they've got degeneration, they may have herniations in the back, right, and muscle atrophy, and they don't have any pain at all. None. And you're like, I don't understand. How can that be? But then I have another person where everything looks great. I mean, I couldn't pick a better x-ray, and the person can't play cricket, and they can't move, and they can't play with their kids. And they're lost. They don't understand why. So when you look at the evidence in science right now, they tell you there is not a clinical correlation that exists between a causation between structural damage and pain. And then you're like, okay, well, where in the world do I start? Right? Well, you start at the back and you see if it gets better. But if it doesn't, then you have to begin to have because then where do you go? It's terrifying. It's nothing's more terrifying than the idea of unlimited possibilities. And that's what it is with the body. But you have to have a system of thinking. And that's what I try to teach people. To think and connect, so you don't have to have somebody come in and say, well, maybe it's this and maybe it's that. You understand it, your body itself, right? And the incidence of back pain overall in all humans, not just athletes, is increasing. It's getting worse. So whatever type of treatment program we're doing, or even rehab therapy exercise program we're doing, is not effective at the moment, right? Because I don't believe in a back care program, because the back has to work with everything else. It's a full body program, right? So because when you do cricket, what body part are you moving?
Every part.
You should be saying
everything.
All of them, right? Yeah. Now, what you said was interesting to me is that those words together, first one was fracture. If you have a fracture somewhere, that means an area is taking a huge amount of load that it can't control. And it breaks like steel. It's only going to hold so much load until it breaks. Right? And what's stress? Well, there you go. That's the load, right? So something is sending the load to the back. And in my world, it's because the load to the back, the lower back, is trying to do the jobs of everything else around it. And it just goes there because that's the central axis pivot point where force has to go when you want to twist and throw something really, really fast. But not only that, here's what people forget. If you want to throw something really, really fast, you have to learn to slow down the really, really fast. That's the control of it. You got to stop it too. Not just throwing it. It's like, can you stop? And most people don't. And that's where the force comes into play. Because one of the things that you'll find in athletics is that athletes typically get hurt on what they call eccentric motion, which means they can't slow something down. They're concentrating too much on concentric, which is generating force. But you're only going to be able to generate force as well as you can slow it down.
It's like brakes in a car, right?
Yeah, well, it's a perfect analogy. I mean, imagine how fast are you going to put your foot on the gas when you know you don't have any brakes? Exactly. Well, you're probably not going to put your foot on there that fast, right? But that's what we do when we go out and we train and we exercise and stuff like that. So you're putting your foot on the gas because you're telling your body, I don't care, I'm putting my foot on the gas. And your body inside, the subconscious, is going, what? That's nuts. Like, that's not going to turn out well for you, but I know you're going to do it. So I'm going to do my best to try to protect you as much as I can. And then that's when the protective response comes into play. But you just don't feel it because your body's designed to protect you from getting hurt. So every time you throw, every game you play, you stack the load, you stack the load, you stack the load, and then your ability to compensate for the load breaks. And then your body now has only one option to stop you from doing more damage. And it's called pain. So you get pain because your body's trying to tell you to change something. It's not telling you that something's damaged. Do you follow what I just said there? Because I told that in the beginning. It doesn't tell you that something's damaged. It's telling you, I need you to change something. And then people ask me, well, change what? Well, first is probably change how you move. That will be one of the first things that I go after, because that just means How do I do that? Well, pay attention to how you're moving now. Because you can't control something until you become aware of it. Mm-hmm. That's what pain is. Think about it. You're not going to do something purposely to control your back, usually until it hurts. Because there's the alarm, ding, ding, ding. Okay, I got to work on it. Right? So the awareness is the first step towards changing something. Right? And here's the next big one, which we'll get into, is the next awareness is, I want you to stop looking just at your back.
Yep.
And then, well, where do I look next? Well, that's what I'm here for. I'm going to tell you.
Well, but it's interesting. I'm going to add another thing into that, because speaking through the mindset of a cricketer, okay, right?
Yeah.
So imagine a pitcher. Like a fast bowler is similar to a pitcher bowling at 99, 100 miles an hour. Okay, so let's take in that consideration. So pitchers pitching at that speed. A fast bowler in cricket is running in, sprinting in to deliver that. They're running and they have a straight arm, and it's a round arm motion to come. They can't bend their arm to try and do it. Straight arm motion. So they need a sprinting. They need a takeoff, like a long jump almost, right? Coming in to hit that
like momentum, building it up.
Momentum,
right.
Yeah, 100% that, right? So the theory, mostly from coaches, is it's their action. Right, so the first point, it's not about anything, not about how well you move or like the pain or anything at all. That it literally is, oh, there's a problem, it hurts, they're hurting their back. We need to change the way they're doing it. That's the thought process here. They skip the movement section. They skip the whole other section of what could be going on, addressing those lifestyle factors that lead to it. So
well, it's both, right? That's the dirty little secret. It's both. Because that's why you have coaches and you have experts in the field to teach you, are you even doing that the way that you should be doing it? Okay? Mm-hmm. But more importantly, here's the thing they miss, do you have the capability to do it even when I'm trying to tell you to do it? Because you don't know what you don't know, you need a good coach. But then, do I have the requisite movement, or what they call motor programs? Can I feel things? Mm-hmm. Can I sense things? To even give you what you're asking for. And here's what I'm trying to tell you. The answer is going to be no. How do I know it? Because every single area I'm going to tell you about right now, most people never pay attention to. They never
That's
look
why
at
you're on the show. That's why you're on the show.
And here's my next question. What do you think the number one reason is that they don't look at these areas I'm going to tell you? Because they don't hurt. They don't have pain. Yeah. So if they don't have pain, well, good to go, right? Not so much, right? Here's a very important thing people need to understand. Pain is the last thing that you feel in an injury process, not the first. Because your body and your brain don't want you to be in pain, because pain sucks, right? Mm-hmm. But you need pain because it's also there to protect you from doing stupid stuff. Like take your hand off the stove. Don't keep it on there because that's not going to turn out well, right? Mm-hmm. But your body compensates and adapts through all the body systems. I'm going to say that again, all the body systems, not just your tight muscles and your fascia, to keep pain from occurring. But that's the load. You understand? It takes the load, it takes the load, it takes the load. Then all of a sudden, it's like the Conan the Barbarian, his riddle of steel. The steel breaks. It can only hold so much. And then there's when you get your pain. And then I said before, that's where everybody goes first. And you should. The biggest reason you should go there first is because your athlete, your patient, your client expects you to go there. So you're showing to that person that I understand, I know that it hurts, I'm showing empathy and caring, and I'm going to treat there. But I've been doing this long enough to know that that's never the single spot that you got to concentrate on. So what I try to show people is to look at some areas of the body that I know have had some underlying vulnerability to them, that if they don't function as well as they can, when you generate force and energy, energy never just disappears. It's got to be transmitted somewhere. If it can't get out one way, it's going to get out somewhere else. That's just the law of physics in the universe. It never dissipates. So if something can't get out efficiently through your arms and your legs, for instance, well, then it's just going to go to a central place. And for most people, it's going to the back, the low back. Now, what's the well, I'm going to tell you why I think it's a single reason it goes to the back, because most athletes get hurt in rotation, twisting. Why? Because that's how you generate an ungodly amount of force, is by twisting. So you coil up and then you uncoil, right? That's hitting a ball, that's throwing a ball. So that's a twist. So that generates the most force in the body. But if you lose the ability to twist in all of the joints of the body, you're going to take it up, and the low back is going to do the twisting for you. To take up what should twist, and what I'm going to talk about in a moment, is around your knee, around your hip, around your ankle, around your neck, for goodness sakes. You need to twist a lot in your neck. And your eyes have to twist. That means looking left and right. That's a twist. And also your middle of your back, what's called your thoracic spine, and your rib cage. So if those areas don't twist well, and I'm going to tell you right now, if you're a human being on this earth and you don't purposely work with those to twist them, they don't twist well. I'm going to tell you that right now. All right? So then, of course, you're going to end up feeling it in the back. Right? But if you twist too much, if you don't twist enough in one place, you're going to twist more in another. Does that make sense? That's all I'm trying to tell you, what I just told you. If one thing, and not just twisting, but bending front to back, side to side, that means mobility. Do I have the ability to actually move? Right? But when you have the mobility, now I need to know this. Can you control it, yes or no? Because just because you have it doesn't mean you can control it. That's where things go horribly wrong. And that's called stability. Stability means you have the ability to resist movement. So I know if somebody has low back pain issues, they have a mixture of stuff that's not moving well. That's a mobility problem. And they will always, always, always have a stability problem. That's the control, like we said before, of can you slow down your momentum high-speed pitch, right? And stability is the key to force production. And Paul Chek, who many people may know of in the world of fitness, he's called the father of functional training, said this: stability always precedes force production, which means you have to have a stable base in order to generate a lot of strength behind it. And what you find is people don't have that, and then that's when they get hurt.
It's a good example of that. Just say take fast bowlers. Like I was playing cricket yesterday, and the first thing I saw was the run up of one of the kids, and so no one had ever said to him before. I said, "Hey, he's quite talented. He's bowling quite quickly." And I looked at him. The first thing I saw was his run up. He didn't have good running mechanics. His gait pattern was completely off. And the second thing was, at the moment of delivery, they take what we call a jump, and they land on their back leg, right? And the back leg needs to be stable to hold that position here. But his back leg was collapsing. He physically, literally, his back leg just collapsed. To me, straight away, he has no stability in that back leg, that back hip. Yet, he's trying to then force it all the way around. And that's when it impacts the whole momentum of the actual delivery stride. But it was his back leg, because he didn't have stabilization. He didn't have any stabilization or core stability in and around that right hip, that whole complex. Just from a casual, I didn't test him properly, but I could just see it. And it made his action so much more forceful. But he lost, I reckon, about 5 miles an hour speed on what he was doing. 100% because of that loss of that stability.
That's huge, man. I mean, that's a really big thing right there. I mean, and because that will impact the rest of the entire movement.
Yep.
When you go there, right? So when you're really talented and gifted and good and you're young, you can overcompensate for those things and not even realize how much force and energy and speed and strength and durability you're losing, because it looks good for you. But you're gonna wear out eventually, and that's the person that begins to get riddled with injuries, or the body's ability to compensate begins to go down, and then all of a sudden your errors go up, and you're not played as much, or you're much more sore after an event, or you begin to notice it even when I'm not competing, my training is suffering, because now your body has to compensate from your event afterwards in your recovery program, right? So just from that landing, if you're landing on something, you're kind of going and you're going to jump onto something, the first place you're going to absorb force, and actually where you generate most of your force, is from the ground up, right? From the foot. But the foot needs to be very stable. So a lot of people don't have good stability in the bottom of the foot. And I'm going to tell you this right now. If you don't have that, nothing you do above the foot is going to hold for very long. You can do all the clamshells you want. You can do all the hip drills you want. But as soon as you stand up and walk, the whole thing falls apart, because your foot takes the brunt of it, right? And then you need the stability, like you said before, in that hip complex. Like, can it take that force and hold you there? If it doesn't, that energy is going to bleed out through the joints above and below. And the joints above and below that are going to start to hurt are the knees. And that's why the knee might cave in a little bit when they load the leg, because it's got to go out. But the knee's also going to cave in because you don't have a stable foot. So the knee in between is just going to get massacred. But what sits above the hip joint? Your lower back. So your lower back starts to take that motion, right? So your lower back is actually supposed to be quite stable. It's not supposed to move a lot, particularly in twisting, right? It can move a lot bending forward and backwards, but it's not supposed to twist a lot. Where you're supposed to twist a lot is in the hip. That's called rotating in and rotating out. And guess what? When you throw a ball, there's a lot of that, right?
Yeah.
But you also have to rotate above the lower back and what's called your thoracic spine and your rib cage. That's actually where most of your rotation should happen. And it's not for most people. But very rarely does it hurt in the middle of the back, because the low back is like, dude, I got it. No problem. I'll take the load for you until it can't anymore.
Yep.
And so I just gave you 3 places to look at right now, and then you actually told them, which is, okay, let me see the stability in your foot. Let me see the stability in your hip, and then how well you can twist. And one of the tests that you talk about all the time, and one that I do all the time for every single person who comes into my office, no matter what hurts, no matter what physical complaint is that I have you take your shoes off and your socks off and put your feet together, and then I say, how long can this person stand on one leg? And what results do you find most often?
No, none of them can. Particularly the moment you close their eyes. And I keep saying it's such a simple test, but it's the most important test I think that we do in the whole body. And again, working with you for such a long time, we now know if we're working with anybody who's got slight pain, or want to increase power and force and all this type of, particularly in cricket, breathing and balance, they're the top of the food chain, right? Top of the food chain when we work with people. And that single leg balance, where we ask cricketers to stand on one leg, take the shoes and socks off, stand on one leg, now close your eyes. How long can you hold that balance with your eyes closed? Right, it's minimal. It's sometimes less than 5 seconds mostly. And we're looking for 30 seconds minimum. Minimum is what we're trying to find here, because that just tells us your brain has no idea where your foot is in space or time, has no proprioceptive awareness, and it freaks the hell out. It literally freaks the hell out. So, Perry, I'd love you to explain a little bit more about why that's such an important thing from a medical point of view.
Oh, that's really big. I mean, how much time you got? I could talk for 10 days on this one. But it's
just
probably...
quick overview.
Honestly, it is probably the fastest way for me to see what's going on with your body. But here's why I love it. It's the fastest way that you're going to notice it as an athlete, because they just need to know, I feel good. I'm like, okay, well, let's see. So as soon as you take your shoes and your socks off, then you've got no support around your foot and your ankle from shoes, because they're giving you artificial stability, right? And I call shoes foot coffins, because they kill your foot, but they actually kill your whole body. Now, you need to compete in shoes, of course, but I need to see how well you can do stuff without the shoes, all right? And when you stand on one leg and you stand on one foot and you lift one up, okay, there's so much stuff happening in there. There's the stuff coming in through your foot, through your joints, through your fascia, all this input into your brain to help your brain keep you from falling, right? So it's a great neurological drill that's going on in there. And you're only going to move as well as that you can balance. Now, I want you to think about this just for a moment. If you're standing on one leg and you close your eyes, I have many people that can't reach 10 seconds with eyes open, and there's no way they're going to get better when they close their eyes.
Nope.
They fall over. And all you're doing is standing still on one leg. What do you think it's going to be like when you're running? Because when you run, you're on one leg 100% of the time, and you're loading it. And then what about when you throw the ball, the cricket ball? Well, you're putting a lot of load, because you have a lot of acceleration and deceleration. It's almost like doing a box jump up and down on something. You got to absorb force. So think about that for a moment, where your brain says to itself, holy cow, Perry can't even stand on one leg for 5 seconds standing still in a room that's nice and safe. He's going to put me on a field where there's absolute chaos coming at me all the time, and he's going to load it up with some of the most intensive, force-generating, rotational-type movements on the planet Earth. But I got to do what I got to do until I can't do it anymore. You're going to get hurt. So if I can just help improve somebody's single-leg stance, they notice that their play on the field significantly improves. But then also they start to say this, Doc, I don't know if this is crazy or not, but you know, my low back is feeling like a lot better. And I didn't get them on a 30-minute low back exercise program. I just had them get better at standing on one foot. And then people say, well, how do you do that? Well, here's the first part. You need to know that about standing on one leg not being so great. It's the awareness part. Because you can't control something until you become aware of it. So I have an athlete that did do 30 seconds on one side, 10 on the other. That's a big difference. You're going to feel that somewhere. I know you're going to feel it somewhere. Okay? But one of the ways that you get better at something, at least in the world of neurology, is they say, I want you to do what you can't do. You just practice standing on one leg more than you do now.
Yep.
And you'll usually get better at it. It's like doing bicep curls. The more bicep curls I'm going to do, the better I'm going to get at doing bicep curls. It's the same thing with the single leg stance, right? Because if you can get that up and you can improve that number and get somebody to where they need to be at. If you're an athlete on the field in a highly competitive environment, you better nail that single leg stance at 30 seconds to a minute without question. No debate whatsoever.
30 seconds minimum. 30 seconds is our minimum cut
That's bare minimum. You should be cruising a minute.
60 seconds. Yep, 60 seconds is the goal. 60 seconds is the goal, and it should be effortless. Not like you can't jump around. But like, you can close your eyes, but if you're flip flopping around on your foot and then moving everywhere, that's a fail. You need to be there. One leg closed, balance, and hold it. Nice and easy, nice and relaxed. And that just tells me your system has got it nailed down. It's comfortable. It's relaxed. It's working. Yeah. It's firing.
Yeah, so right then and there, it's actually more of a neurological exercise than it is a rehab physical exercise. I call them neural exercises because you don't need to do it a lot to get a lot of positive feedback and progress on the end of it. because you're working directly with the brain and with the nervous system. So that in and of itself will give you a lot of improvement in your lower back pain, just being able to balance on one leg. All right, that's the load. So I have people that are runners. They run, and they can't stand on one leg for 5 seconds. And then I say, you're a runner. You should be able to stand on it for 30 seconds. And when you run, like I said before, 100% of your time is on one leg. You are going to have an injury somewhere that runners get all the time. Usually it's foot injuries like a plantar fasciitis. But more importantly, I tell people this. You don't even realize how much durability, speed, stamina, and recovery and strength that you're losing. Think about how much better you could be than you are right now just from changing that one little thing so you can go harder, faster, stronger, hashtag beast mode monster for that. But most people don't, well, I never knew about single leg stands. That's why it can be such a big life changer when you do it.
It is.
And then go ahead. And then one more thing, then the thoracic spine one, that's the one where we see how well you can actually turn your torso to your left-hand side and turn your torso to your right-hand side. Now, with athletes, that's typically going to be you'll go one way more than the other because you do repetitive twisting towards your dominant side, and that's okay. I'm not looking for perfect balance in rotation. I expect you to be able to go one way further than the other because that makes you a monster. But what I need to see is that you're not losing too much on the opposite side. The yin and yang, the balance, the give and take.
It's interesting you say that because without name dropping and saying, I saw and had the privilege of working with somebody very famous a few weeks ago. And I did one of the rotational tests with him. It was a standing rotational test because he was in cricket gear. I couldn't do anything else. And do you know what happened, Perry? He went into complete spasm in his diaphragm. His diaphragm went into complete spasm whilst doing it was standing rotation. Feet together, hands out to the front, rotate one way, go the other, and his diaphragm just went boom. It had to take 2 minutes for it to settle down.
Wow.
Literally 2 minutes for it to settle down. Elite, at the very highest level athlete in terms of cricket. And, few issues ongoing, but it wasn't, not saying he had back pain right then, but it's another sign of something potentially not working well and as efficiently as they hope, which, if you can't rotate in cricket, what happens, as we just said, you can't produce as much force.
Yeah, and if you do produce it, you're going to produce it from the wrong place.
Yeah.
Or too much from one place. I actually don't even think, I hate to use the word wrong place because it's actually the right place that your body needs in order to help you do your motion. It's just taking that place to do it. Because if it didn't do that, it would be way worse for you. Right? So the body never does anything without a reason. It's not stupid. Everything is designed to protect you and help you keep going as long as you can without having physical pain and ultimately not have you have a catastrophic injury and ultimately death. So all these compensations are actually normal. And somebody's ability to deal with those compensations is individual. A lot of times it's somebody who has a natural talent, for instance, but hard work is going to take talent out eventually. But it's also, and I know Gray may have talked to you about this, when people have low back pain, they just go after that you have a part of your body that's damaged. One, it's not a part. It's the whole thing. And how do you know it's damaged? But two, how are you living your life outside of your sporting event or outside of going in to do my training and my low back pain exercises? It's like, do you have a really stressful home relationship or a relationship out in the public if you're in a high profile sport and you got the stress of competition and performance, and maybe you have your troll haters on social media and you check that every day, and are you eating well? Do you hydrate? Do you sleep? all those things are components that are going into your nervous system, and your nervous system has to deal with all that stuff. And if you have so much of these outside things going in, there's so much noise happening that your brain can't let your back go. So sometimes it's just a matter of, I tell people, tell me about the other parts of your life. Let's just stop focusing on your back for a second when you're going in there. Because here's a big mind blower for people. One of the reasons that people don't get well when they get injured in athletics is they're doing too many things to try to get better. What do I mean by that? That's just what I told you. They're doing all of this rehab. They're doing all of these programs. Those are all stressors to the entire system. So when you're overwhelmed with stress and pain, you cannot tolerate a lot of stress. You get overwhelmed. An overwhelmed nervous system is very easy to overwhelm. So people think go harder, faster, stronger, bigger, better, more is more. If I can do 5 rehab exercises, let me do 10. Wrong. Because when you keep pushing on a body that's in that pain protective mode, it's going to do 2 things. It's going to push back on you harder, which means pains get worse. Or it shuts down and it won't let anything change to try to protect you, and you stay the same. You don't get better. So that's why, if we take this in context, sometimes I'll have people that by the time that they usually see me, they're doing everything they've said, you need to do this, 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 this for your lower back, but it's not working. And I have them stop doing all that stuff and then go back to something simple, like just practice the single leg stance every single day for about a week, and then get down on the ground and do a couple of these easy breathing patterns that, we have them do, and that's it.
Brilliant.
And the majority of the time they'll feel better because they just lessened the load on the entire body. And I think that's really, really important for people to understand, especially if you're in the world of cricket and athletics. You're expected to be a monster all the time. But you got to pick your battles, because if you don't, you're not going to be a monster for long.
No. And we're seeing it more and more, particularly, again, talk international fast bowlers, they're breaking down. Even an international spinner, Jack Leach, has broken down with a stress fracture recently in his back. So it's becoming more and more prevalent in the world. And there's a lot of youngsters who've got back issues, who are trying to come through the academies, break it through professional levels. So it is a huge topic.
Well, you know what's interesting here is, I don't want to get too far into the weeds here, but one of the things that when we talk about, to see how well, one of the things we do is we have people put their feet together so they touch, and then I say, how long can you stand on one leg? Eyes open first. Because if you can't do it with eyes open, trust me, you are not going to improve when you close them. Then I'm going to say feet together so they touch. Now twist your torso as far as you can to one side. I let them choose the side. And then they go to the opposite side. And I see how far they can get. But you have to keep something in mind. When you rotate your torso that way, that's not the only thing rotating. Your head has to rotate. Your cervical spine has to rotate. Your shoulders rotate in and out, opposite sides. Your hips rotate in and out, opposite sides. Your tibia and your femur, which is your knee joint, and so is your ankle. So when I do that, every single one of those places plays a part in rotation. And if you can't get proper rotation in your thoracic spine, in a hip joint, in your ankle, or in mostly your upper cervical spine, the first couple of joints below your skull, that's where most of the rotations should happen. If either one of those or all of those don't rotate well, guess where it's going to go? The back. That's where it's going to go. All right? Or it's going to go and you'll get an injury in your arms and your legs. So your elbow will hurt as a pitcher, right? Or your knee can hurt, especially if you're, at least in America, if you're in football and you have to do a lot of stop, pivot, shift, turn, rotate. And we get all those non-contact ACL injuries. Same damn thing. It's just going from a different place, right? So what I do is we look at working on all of those areas to improve how they move. And then you can also work with the lower back. But the only way you're going to know that is to watch somebody stand on one leg and watch them twist. Where in the old days for me, I would put you on a table and just start treating your back.
Yeah. And that's what we're seeing lots of people do.
I want to smack myself in the head because of doing that. Right? And another big thing that I tell people is that, you know, when you have a lot of pain in the lower back, I want you to pay a lot of attention to doing some treatments and massage and therapies and release and stress reduction techniques in the front of the body, around the abdomen. That's why the diaphragm works so well when you treat breathing and you treat the diaphragm, because you're going to improve the lower back pain. If you don't own your diaphragm and you don't own breathing, you will never, I'm going to say this again, you will never own low back pain long term.
I can't say that enough. But the thing is, though, it's not sexy, Perry. Like, you know, like if you say, hey guys, look, in the warm-ups I do with Cardiff and the Wales boys, like all the time, I get them into that one position to open up the diaphragm each and every time. I say to them, this is the most important exercise that we'll be doing today. Yeah. Opening up the diaphragm and get it moving, just breathing, but importantly, it'll improve your rotation, gets everything switched on, and we're going to get going here. Yeah. But it's not sexy, and no one's talking about it. They want to talk about other stuff, like how to get faster, you know, hashtag beast mode, all that type of stuff. But coming from you now, and you know, just sharing your expertise, let's talk about the role of breathing in the diaphragm in lower back pain and why it's such an important thing. Because we talk about balance. Because, like, you know, but we at Strength Matters, Cricket Matters as well, we put breathing above balance. Can you just talk about these? Let's talk about what are these two things, combining the two things. We talk about balance and single leg balance, but what about breathing?
Sure, but let me go back and address something really quick. Yeah. When they say that breathing is not sexy, right? If I have an athlete that tells me that, right? But then I'll ask them this: say, do you like winning? The answer should be yes. And I say, do you think winning is sexy? Yeah. Do you think losing sucks? Yeah. Okay. Well, if you start to do the breathing, you're going to get more of the winning and less of the losing. Which one would you like to do? Right?
Yep.
That's it. Right? Because they're going to notice the differences in their performance really quickly. That's why these are so powerful. You don't have to wait a week or a month to see how breathing changed your strength and your power and your range of motion. It's a light switch. Then you got the buy-in, right? Then you got the buy-in. So, breathing above balance is actually more critical. And here's the reason why. It's hard to balance if you're dead.
Yes.
So to your brain and your nervous system, breathing comes first, right? And the breathing is the survival mechanism, and breathing drives the stability in the body, the power in the body, right? And then you can have better balance. But your balance is really going to struggle to get well if you're not able to breathe when you balance. Okay. That's actually a really cool thing to do. I'll show you how you mix these two together. Is that when the nervous system feels safe and comfortable and it can feel like, I got this, I'm good, it will be able to breathe easily and normally and well. It won't struggle. But if you put your feet together and you stand on one leg and somebody stops breathing, first thing I know is their whole body is freaking out because they stopped breathing.
Yep.
Why did you stop breathing? Well, because the nervous system's freaking out, right? So that automatically tells you that there's an issue. So you need to be able to control your breathing comfortably through these rehabilitation movements, assessment movements, training movements. That's how I know that you actually own the breathing. And when we say breathing, we mean through the diaphragm muscle, which is the bottom part of the rib cage here. It's like a muscular umbrella that sits over your organs like that. And that muscle engages when you inhale and exhale. The most important thing about the diaphragm is it helps you control pressure and stability. What did I say about stability before? In the low back, everywhere, right? Diaphragm breathing is a stability mechanism. It actually attaches physically to the lumbar spine. So it's a stabilizer. But it also controls pressure, because whenever you inhale, you increase pressure. And when you exhale, you decrease pressure. Inhale, exhale, inhale, exhale. And pressure moves things. And then people say, well, what does it move? Well, it moves you. It moves your organs around, up and down like a piston, right? All that movement in the abdomen there helps build that stabilization in the lower back. If you don't move well in those organs, you will start to have inflammation in the organs because they're not moving. Right? Think about any body part that you have. If you don't move it very often, it's not going to feel that well. It's the same thing with the organs. So you won't get a lot of movement in the abdomen, aka your core. And then when stuff doesn't move, I mean everything. Blood doesn't move well. Lymphatic fluid doesn't move well. All the nerves sit in that stuff, and then you're going to get inflammation in the abdomen. Right? And then you can feel that anywhere. That's why I told you before, I want you to massage around your belly and then practice some of your breathing after you massage. Massage the belly first so you can loosen things up. Then practice some of your diaphragm breathing. And there's many, many different ways to do that, honestly. I mean, that could be a podcast on its own. Yeah. I just want you to type in Google somewhere diaphragm breathing and look at some different options. And you will notice an improvement in your lower back for sure. Because here's what I know. If you don't own the breathing and you don't own the movement and the organs in your abdomen, your back is always going to struggle. It's always going to struggle. But many people don't feel the physical pain in the front. They just feel it in the back. And that's what stop chasing pain means. You know, treat the back, but then, look at the front. Yeah. And then my other joke is, I'm like, well, how do you know the front of your body doesn't hurt? And then I tell people, let's see. Let's pop you on my table, lie on your back, and I'm going to stick my fingers in there. Every single person hates me.
Let me tell you, I hate you for that. Literally, I remember you did that. You did that
But
to
here's
me.
my point. It's not supposed to hurt. Yeah, see, it leaves an impression, doesn't it? Right?
It does. Like I wanted to punch you in the face. I literally remember that. It was Perform Better Summit in Munich a few years ago before I understood the whole actions around this. And you go, let me have a look down the front here. And you went down the sternum into my stomach, my abdomen. It was freaking hurt. It was like wow, what is going on here? It was like a big aha moment. But that's what we did. And then ever since that day, man, like I've got one of these mobility WOD balls that I use as part of my warm-up for every time I go train in the weight room or anything at all. I spend 1 to 2 minutes rolling and massaging my abdomen, which gets everything moving, which means everything doesn't hurt as much. However, I remember you told me, massage your stomach for 20 minutes a day, it'll change your life. Something from Chinese medicine, I think you said. Something along the lines of that, right? And I just couldn't get over how much it was clogged up and how much, what it does, like that light bulb moment, the instant rotation improvement is phenomenal afterwards. Yeah. Once you do it, but you got to spend enough time at the start. Because most people are going to be clogged up at the start. From personal experience, having learnt it from you and going through that process, you'll find it hurts like hell, it's clogged up, and it's going to take a couple of weeks before it starts to ease off and open up. But you'll notice that rotation, left and right, random hip pains going. Like literally, it is incredible, but you got to stick at it. And at the start, I was about 5 to 15 minutes when I had time. And I'm really conscious effort on it. Now it's more maintenance. 1 minute, that's fine, absolutely fine.
Yeah, it's huge, man. It's a life changer, honestly. And then you don't have to start with 20 minutes. You just start. You just try 2 minutes. right? And then you just do it every single day. You be consistent, like our friend Dan John says, little and often over the long haul. But you have to remember, when I was telling you about the standing and twisting, I was talking about joints and muscle and fascia. But you know what else has to twist? Your organs have to twist. That's why your elite athlete had a diaphragm spasm, because they're not able to twist and get freedom of motion in the diaphragm, which physically attaches through connective tissue to your organs, right? And so people always say, how do you know you have an abdomen problem? I'm like, that's easy. You're alive on this earth. I already know it's a problem. I just need you to know it and you to start to work with it. The biggest reason it is because you've never done anything on purpose to take care of it, right? Yep. And I have a saying in Stop Chasing Pain that I would like to say, because it's one of the biggest teaching things that this whole podcast is about, is that no system in the body ever works alone, never gets injured alone, never heals alone. There's no such thing as an isolated injury in the body. There's no such thing as isolated recovery. It's all or nothing. All of these body systems, from your organs to your fascia to your blood to your ligaments to your nervous system to your immune system, they're all trying to help you and adapt and compensate and lift the load somewhere for somebody so you can have a better quality life and not get hurt. And the organs are always overlooked because nobody complains of pain in the abdomen. But if those get stuck together, or you have inflammation in there, it's going to be really difficult for you to get the motion that you need to. And if you do get it, you're going to take it from all the places that are hurting you.
Exactly. Oh, Perry, this is great. Like I love, this is the thing. You explain the things so much better than I do. This is why we had you on the podcast in the first place. You know, this is your domain. This is brilliant. I'm just one of those S&C guys that just says go and lift some weight and do stuff like that. But you articulate in a way that we're hopefully conveying across to people now, in, you know, opening up their mind, expanding their horizons on how back pain can be caused. Now, for those who are at home now going like, okay, I've got some back pain, right? I've got some back pain. We've talked about balance. We've talked about breathing, right? What would be some things that they can do at home very quickly to self-assess, right? Just a very, very quick standard little thing. What can they do at home now to see, you know, okay, where could these issues be arising from? What are some of the tests you would suggest they do?
Okay, let's keep it kind of simple and review some of the ones that we talked about. When you're home, and take your shoes off, take your socks off, put your feet together so they're touching, and you can either, you know, film yourself or have somebody else watch you, or you can have a mirror. I want you to make sure you're in an environment where you have some clearings around you, because if you start to lose some balance with this thing, I don't want you to fall and get hurt. Just raise, you know, one knee up in the air and see how long you can stand on one leg with your eyes open. Just look straight ahead and pick a spot. And you should be able to reach 30 seconds, no problem. And then you put it down and you do the same thing on the other side. And you just compare sides. If you do relatively well on that, then you repeat it with your eyes closed. You just stand with your feet together. You close your eyes, and that's probably going to freak a lot of people out already, and they'll feel like they're a little bit off balance. But, you know, try to raise one leg up and see how far you get. Most of you will probably be blown away by you falling over within 5 to 10 seconds. All right. Yeah. And then all I want you to do is just start to practice standing on one leg with eyes open. Don't practice with eyes closed. I need you to own your time with eyes open first. Just practicing over and over and over and over. If you combine that with getting some stimulation to the bottom of the foot, you take a little bit of a lacrosse ball, a rolling ball, some soft tissue ball underneath the tissues on the bottom of your foot, and then you do the single leg stance, you'll probably stand up a little bit better, and your low back will feel a little bit better because the muscles, the tissue on the bottom of the foot connect to your lower back. So the foot and the low back pain always go together. And the other one is the rotation. Just keep your feet together so they touch. Twist your torso as far as you can one way. Twist as far as you can the other way. And then see how far you can get from one side to the other side. All right. And then to get that a hold, you're going to practice some breathing. Because if you practice some breathing, it will usually help you rotate further. All I want you to do from this point on is just lie on your back, bend your knees, put your feet flat, or you can put your feet up on a chair or up on a wall. I need you to be good head support. Make sure you have no pain, no discomfort, and you feel safe. And I want you to just massage around your belly button and around your abdomen and underneath your rib cage lightly on both sides for like 2 minutes. And then from there, I just want you to put your hands on your belly and keep your mouth closed, mouth shut. I want you to breathe in through your nose for 4 seconds. I want you to try to go out through your nose for 6 seconds and repeat that for a minute, like 6 times. That's it. Because when you breathe in and out through your nose, you'll automatically engage the diaphragm more without thinking about moving the diaphragm. You want to keep your mouth shut. Your mouth is for eating, not for breathing. You just do that, right? And you'll likely notice, holy cow, I can't believe, that's crazy how much different I feel. And then when you keep practicing that, the body, the brain, and the nervous system will begin to learn, and it'll start to take those brakes off the protection. And you'll notice then you can start to add more of your other exercise. Because I still want people to strength train, and I want them to be monsters, and I want them to lift up heavy things and put it back down. All I want you to do is mix some of these things in before you begin or in between when you do those things. Does that make sense? Yeah, and make sure that you just make sure you're hydrated. If you're dehydrated, your back's always going to hurt.
Yeah, most people are chronically hydrated, and it sounds crazy. We're not giving you like exercises. Go and foam roll this for 20 minutes, 30 minutes. This is quite simple, but it's quite complex in the same way. It's simple, but it's not easy, and people overlook these basics first and foremost. We can go to other stuff later, but these are the basics you got to own first, right?
Yeah, and so there's nothing wrong with foam rolling, but what I will contend is that if you can balance better on one leg, you can own your breathing and your abdomen and your rotation. You'll likely find that you don't need to foam roll, or if you do, you don't need to do it as often, and that they complement each other, right? Because the ones that I'm showing you with the standing on one leg and doing the breathing and the abdomen, those are all going to help you build up stability, which is the control, right? Foam rolling helps you get mobility. Yeah. And most people have a stability problem. So I will contend if you can foam roll for 3 days straight, but if you can't breathe, you can't stand on one leg, you're wasting your time. I'll stand by that until I'm dead.
And that's a perfect segue, actually, because a lot of people will say, okay, let's go back to the back pain. Okay, we're talking about lower back stress fractures. The stress fractures are kind of the reasons why it happened. But let's go back into tight muscles, right? Let's talk about, around the middle of the thoracic, right? The middle of the back, and because most people, everyday people, will go, oh, the muscles are really tight around the lower back left part of the back. So obviously I'll get you to explain certain muscles around that area in a second, but let's just say, it's always my lower back left that's really hurting. It's really tight. I just need someone to release it and massage it and get it out. What are your points to those guys? Because that is what happens around the world constantly. And, not just with cricketers, but they got a tight muscular lower back, so therefore they go for massage and go to here. Let's just talk about that idea and what your thoughts on that are, if we can.
Sure, and there's nothing wrong with that because it feels good, right?
Yeah,
I mean,
it does. 100%.
Working on muscles that are tense and tight, it helps them relax and helps them feel better, and does bring blood flow into an area and helps get waste material out. And it just feels good to have the human touch most of the time there. But then you always have to ask yourself, why in the world is it tight in the first place?
That's it, and that's the point I'm trying to get across. That is exactly what I wanted to get at, and make sure.
Or why does it keep coming back? If you have to keep massaging a tight muscle, let me tell you a really cool phrase here. Muscles move bones, right? Otherwise, you would just be bones on the floor, or you have to be one of those skeletons in the corner, right?
Yeah.
And the pull that's going up the skeleton is given its stability that it needs, right?
Yeah.
So muscles move bones, but brains move muscles.
Yeah.
So whenever you're working on a muscle, you're not working on a muscle, you're working on the brain and you're working on the nervous system. That's what you're working on. The only time I'm ever going to look at a muscle as a problem is if somebody took a machete to it. Or or you got a needle in it. That's not it. You have to go after the brain, because why do things tighten up? For protection. Mm-hmm. They're trying to protect you from something, and they get tight a lot because they have to do the job of something somewhere else. Balance. And here's another thing. When stuff gets really, really tight, it restricts movement, right? Mm-hmm. Well, that's a form of your brain giving you the stability that you don't have by tightening stuff up so you do get it. You understand what I just said there?
Yeah.
So it's neurologically trying to make you stable the best way that it can. That's why people get worse or they don't get better, because you go in and you release the muscles that your nervous system and your brain are giving you to protect you. But you're not going after why it's there to protect you. And then you get off the table and now you have nothing, absolutely nothing. I took away what you did have for protection, and you don't have the protection in the other place either. So your whole nervous system goes, oh my goodness, this is awful. So what it does is it doubles down. It comes back and it tightens it up even more or even harder. Or it says, I'm just going to pick another place. And instead of 2 places to protect you, I'm going to give you 5. And that's the person who hurts here and then here and then here and then here. And you're like a pinball machine all over the place like that, right? Mm-hmm. So I need to relax the tension in the muscle. I got to relax. I got to say, okay, it's okay. Let it go, let it go, let it go. And stop thinking of you're letting the muscle go. Just think about your whole brain and your whole nervous system saying it's okay, let it go. Then you need to work on the stability stuff that we told you before. Because when you do that, now your brain and your nervous system may not need to use that strategy of protection. It's like Gray Cook says, he does demonstration all the time, is that tight hamstrings. Mm-hmm. Right? Everybody has tight hamstrings, because one of the other tests we do is put your feet together so they touch. Can you bend over and you touch your toes? Most people can't get anywhere near it, right? And we all know what the treatment for tight hamstrings is, right? You stretch the hamstrings. Wrong. That's the worst thing you can do, right?
Exactly.
Because when you stretch a muscle, it reflexively tightens up again. Yeah. But Gray always says that when you're bending forward, you're bending forward. Right? And first of all, when you're bending forward, guess what? Your organs have to slide underneath your diaphragm when you bend forward. What happens if the organs can't move under your diaphragm? Well, you're not bending forward is what I'm telling you. Or your nervous system has to say, holy cow, Perry doesn't have good balance and he's bending forward, so I have to stop Perry from face planting and falling over and damaging his pretty face. Mm-hmm. So I have a novel idea. One, I can hurt his lower back. That's going to stop him from bending over. Or 2, I'm going to tighten up the hamstrings, because they are protecting you from falling over, right? Or, like I said before, that's why I tell, if you massage your abdomen and you release the tension around the organs and you get some of the blood flow there and the congested lymph flow out, and I get your diaphragm moving better, all those things slip and slide over each other. You give yourself more stability in your spine. And then when you bend over and touch your toes, most people say, that's nuts. That's crazy, right? Because your brain said, hey, you finally found the spot, man. You didn't go after the hamstrings.
Yep.
Now you're learning. Now you're learning, right? Exactly. And then all of a sudden, these things start to hold. The one thing that I learned from Gray Cook early on when his study group was looking at how humans learn to move in the first place, right? We call that neurodevelopmental learning, seeing how babies learn to move in order to stand up. Okay, that's all neurology. That's pre-programmed, and nobody had to go to a certification class or read a research study on how to freaking stand up from being a baby. It's hardwired. You ever see babies? They have so much mobility, they're big blobs of nothing. Like they could put their foot in their mouth and bend all this. They have a lot of mobility, but they have no control over it. So that's why if you put them on the ground, they're just a blob, all right? And you have to hold their head because they don't have any stability and the head's really heavy. Right. So they have the mobility, but in order to stand up, they need to have the stability. They need to have these anchor points to be able to move on and control that mobility. Once they get that stability, that's when they're able to now start to stand up and then take a step. And they usually fall down because they don't have the control part yet. And then they learn. So in my world as a chiropractor, I was taught to go after segments in the spine that are stuck and not moving well. They call them subluxations or fixations. And they do that in different healthcare fields too. They're called mobilizations. You basically take stuff that's stuck and you unstuck it. But I never started to ask, why in the hell is it stuck? And what blew me away was, why do I have to see the same person 3 times a week for a month and keep unstucking stuff that's coming back all the time? Because I wasn't doing anything else but getting the mobility back. Mm-hmm. That was the thing for me to say, holy cow, what's the stability stuff? It's like I found a unicorn. I never even thought about it like that. And that's when I started to do the movement things with the breathing and the standing, and then my all-time favorite movements, rolling down on the ground in many different ways, called rolling patterns.
Yep.
And if you can do rolling patterns down on the ground, you'll be an absolute monster on 2 feet. I mean, you're going to stand on the podium and you're going to win 9 times out of 10. And if you get that and you combine with the other ones, that's what I was looking for, because most people are chasing after mobility, and that's okay, because here's what you need to understand: like you need to have the movement available. Then you need to control it. But that control, very important that you listen here. That control comes from the brain.
Yep.
It doesn't come from the muscle.
No.
So you have to go after the brain.
I love how the muscles move bones, but the brain moves muscles. It's just such a simple way to explain to people that you can't just go after the muscles, which people do time and time again. Do you still use? Because I remember when we first met. God, this is early 2010s, I think it was. It was your rail system. Do you still like use the rail system with a lot of people? Because we tend to use it a lot as well. Is that still part of your teachings, or have you adopted it over the years?
No, it's the same fundamental principle. I may not use the same acronym, but I'm going after the same thing. It's just based on that premise. I'll explain what rails means in a second.
Yeah.
Of, giving somebody the ability to get the motion first, the range of motion. Yeah. So R stands for release. I need to release the tension or the motion. Maybe it's muscle, maybe it's fascia, maybe it's a stuck ankle joint. Right, the ankle mobility problem. So, yeah, I mean, I can move those in my sleep. Just that's the mobilizations that we do.
Yeah.
So I release it, and that's all I used to do. And then I'm like, okay, it's good, but I realized that it wasn't, because it kept coming back. Then A stands for activate. Activate means that, okay, well, I need to activate something that obviously is not working well, because that's why you lost the mobility in the first place. Because something's not working somewhere, and your brain's going to lock something down so you don't get hurt, right? So I'm going to release the stuff, and then now I'm going to activate some things. The breathing is, I'm going to go back to the breathing over and over and over, because it is. I just have you do a couple of diaphragmatic breaths in there. And you can do, even now I go even deeper by integrating the eyes and the head into things, because they're really great at activating parts of the body, the nervous system. And so I'll do that, and I'm like, okay, well, now I've got the range of motion, and I activated something that wasn't really working well. Now what? Now I have to teach them how to play nice together, because they don't know how to do it. They're disconnected. I have to integrate. Integrate means work them together in a pattern together. And that's when I do a lot of those things down on the ground with the rolling patterns. Just roll over to your stomach, roll over to your back, roll forward, roll backwards. Just, do a lot of different type of, I don't care what you do. You could roll over onto the ground in an army crawl. I don't care what you do. I need you to integrate movements, but you integrate it in an environment down on the ground where there's lots of stability from the ground. You understand? Because the ground's not going anywhere. So that gives you the stability that you didn't have for you. So it's much easier. I'm not overwhelming your overwhelmed system, right? Mm-hmm. And then so I release, I activate, I integrate, and then L is locomotion. Now you stand up and you go monster mode and you walk and you carry the heavy load or you push the sled and stuff like that. So basically what I do is this. When I have somebody that needs some issues, they get them down on the ground, and then we release some tissues. You can do some foam rolling. You can do some variable resistance band, rock floss bands, or you can even have therapy done to yourself. Then you're going to get some activation. Start some of your breathing. It's going to be the easiest one. And then I'm going to integrate it. I'm going to have you do some patterns together where you use your arms and your legs or you twist or whatever. And then from there, now you can stand up and I'll do my traditional like rehab exercises, if you will, right? Yeah. Or just walk to the back, walk one way and then walk backwards. And I have another idea. Why don't you walk backwards? Or you walk in a circle, or you walk in a figure 8 pattern, which is a really, really great one.
Infinity walks are a huge one for us, particularly with people's balance. They're great.
If people want to know what that is, just type in the word infinity and then the word walk behind it.
Yeah.
You start to do that, you'll make a huge change in your body, because now you're really starting to twist some things. Right. Yeah. But one of the reasons that's so successful is because I mentioned it before. You're really going to have to use your eyes, which move. You're really going to have to use the upper part of your cervical spine, your neck, and you have to use the balance system in your inner ear. So when you use all of those together, right? Because here's the thing, I need people to understand is that, if I'm going to ask you to bend over and touch your toes, what's the first thing you have to do? You got to look at your toes. Mm-hmm. So your eyes are going to drive the movement. And then when you bend forward, you need your inner ear vestibular system to turn on so you don't fall over. So the first thing that you use to touch your toes has nothing to do with your back. It's in your ear, your eyes, and what? Your neck. Here's something that I learned years ago that completely blew my brain, man. Is that you have these, every part of your body has sensory receptors in there. And then there's many different ones, but the one most people are familiar with is called proprioceptors. Anybody heard the term proprioception? That's the ability to, like you mentioned before earlier in the podcast, be able to sense things and feel things. So my brain knows where my body is in space and time. So all your joints have a lot of proprioceptors in them. The muscles have a lot of proprioceptors. So do your organs. One of the places that you have the most proprioceptors, like I think it's like 50% more proprioceptors here than anywhere else in your entire body, are the first 3 joints at your head and your neck up top, the first 3. So that's why if you turn your head or you look up or you look down, if those don't work well, if that area is locked,
it's tight, yeah,
then you lose a lot of the input going into the brain. And when you lose some of that input, you automatically put a strain on your lower back, right? Because the proprioceptors are what your brain uses to know, can I let you put the gas on or do I have to put the brakes on? Yeah. And if you don't own those first 3 segments in there, that's going to be a break.
Certainly, it's so funny because cricketers have very tight necks. You see it, and their ability to rotate and look. Because let's take a batsman for example. If you can't rotate and get your head in position to get an alignment when you're facing the ball, like a baseball pitcher for you, man, trying to hit it. Like you're going to compensate with other parts of the body. So if you can't rotate and move, and most people have chronically stiff necks, just below the base of your neck, guys, like if you put your thumbs in there, you'll feel tension. Most people feel tension. It hurts like hell. You know, like you've got to be aware of this. That's the first point of being aware. Is it tight? Is it tight down the side of your neck? Right? Is it tight here? It stops you from rotating. You need to address it because the things closest to your brain matter the most. Breathing, balance, all this stuff up here, you've got to take into consideration. So stop chasing pain, quite literally. Don't go after the lower back. Yes, look at it and acknowledge it, but start looking at these things we've been sharing today.
Yeah, so you actually gave someone right there. Just massaging the muscles in the back of your head can make a big difference for somebody's, back pain. And what you just did there was what I explained about touching your toes. You have your cricket person, you just demonstrated standing up there, and they looked at what? The person they're throwing the ball to, right? So what's the first thing they did?
Eyes.
They move their eyes and they turn their head. So they fire. The back is going to follow what happens up there.
Yeah.
You understand?
Yeah.
So when you have low back issues, I'll give you another little golden one here, is that whenever your lower back hurts, you always, always, always have to do some work up top with those first three parts of the head up there, and then your low back will feel a lot better. And then people say, but it doesn't hurt up there, doc. I'm like, yes, now you're catching on. Now you're getting it.
Until you dig your thumbs into it, and then you'll go, oh my God, it kills. Like those reflexive performance, like the Chapman points and reflexive performance reset type ideas. Like you go into there, it's like, it kills now just going into it for me.
And you want to know something that's even cooler? Something. I know we're running low on time, but you can tell the stuff excites me. The eyes have muscles that move them. They're called extraocular. Ocular means eye, extra means outside the eye. Those extraocular muscles are linked to the muscles in the back of your skull. So if you actually put your thumbs and your fingers like you were showing underneath the back of your skull, and then you move your, right there, and then keep it there, and then you move your eyes left and right and up and down, you'll feel those muscles fire underneath your finger.
Oh my God, yeah.
So what I'm telling you is, like, you'll have issues with the back of your head if you have issues with the eyes. That's why elite athletes always have to do some type of eye training. And so it's the eyes and then the back of the head, so it's both together. But everything, like I said before, everything is interconnected, and you can't just go after the back. But this is why I get so frustrated with traditional medicine and medical and scientific research, because they go after one part and then they put you in an environment that is not like real life. And they only put you through a certain amount of things, and they say, okay, this we didn't find, this we did find. That's not valid to me at all. Zero. Because it depends on the individual. It depends on their environment that they live in. And not every person's back is the same, because each person's back has had a different journey to bring that individual back to where it is now. Okay? But that's why I like these universal things, because improving breathing and improving balance always has carryover to everything else. That's why they're so effective. No matter what type of back you have, or how you injured it, or how long you've had it, it will always make an improvement for you. How much, I don't know, but I do know this much. If you don't own the breathing and you don't own the balance, you won't own the back no matter what you do.
No. And that right there, Perry, is the biggest takeaway for everyone listening to this podcast right now. It's not what the traditional people think. Yes, we can dive there later. Own the basics first and address basic lifestyle needs. Sleep, hydration, movement. Are you walking enough? Is a couple of things. Reduce stress and breathing and balance. That's amen.
That's sir, you nailed it.
That's essentially what we're trying to get across with today. Wow, Perry, you know, as always, we can talk about this shit all day long and like keep going about it. This is just one segue into this, and we can go into the world of baseball, shoulders, and I think 100% we're going to have to bring you back on the podcast once people have had a chance to digest this and talk about other areas that would massively...
It's going to take a little bit, yeah.
It is a little bit, I think so, for sure, because we can go so many routes, like improving power, improving rotation, improving shoulder issue, you know, all these things that are important to cricketers. We can go down that line here. But for now, Perry, I can't say thank you enough for coming onto the show, sharing what you do to the audience here, the Cricket Matters world. So on that note, for those who want to know a little bit more about you, who want to dive into the crazy mojo that you do most of the time, where can they learn more about you? Where can they find out some more stuff?
Oh, thank you very much, my friend. Had a great time. Very easy to find me. We began the story talking about how I discovered and found Stop Chasing Pain. Those are the 3 words that you have to type into a search engine, and I'm going to show up. My website, stopchasingpain.com, has everything that we do and all of my social media connections, and they all have the same name, stopchasingpain.com. So, yeah, I've been doing this stuff for a long time. I guess I was one of the early adopters, if you will, on the internet and YouTube and podcasts, because we have we have our own podcast called the Stop Chasing Pain Podcast. And I read an interesting stat the other day that the average podcast lasts for 3 episodes. And we've had ours on for 13 years.
Yeah.
Long time, right?
It's been a long time.
So, yeah, which I love to do. But yeah, I had a great time. Thank you everyone for tuning in, and I'll be back whenever you want me.
Hell yeah, man! He literally, because he's a good friend. We're good friends, you know. It's such a good thing. I mean, like usually we get to. I've never seen him like in the States. It's usually around the world we bump into on the speaking circuit. So with everything happened post COVID, everything's changed, isn't it? So we're due a big catch up in person, actually.
Oh yeah, we are. I used to before the zombie apocalypse that I call it. I used to come to the UK 3 or 4 times a year, sometimes, and travel all over the place. But the reset button was hit.
Yeah,
and
Thanos blip.
Changed things up a little bit. But I think I'll get back out there again. There's a lot to be said for being in a room with real live human beings that you can connect with and learn from, which I love. Yeah. One of the reasons I love to teach is, one, it's the best way for me to learn.
Yeah, dude. I tell you what, thinking out loud in the podcast as we're doing it, because we're still recording, is it might be worthwhile bringing you to Cardiff at some point, because I think you'd have a line of people coming out the door wanting to work with you in terms of dealing with their pay, which I think is something we can potentially work on long term. We can have a think about. But Perry, honestly, thank you so much for coming on the show. For those who've listened in and want to please share the podcast around. If it's helped you, please share it with people around the world. Take a screenshot with your mobiles, share it on the Instagram platforms, the TikToks, wherever you want to share it, and tag us on it so we can get this out to more people, because I know there's a lot of people in the world of cricket that have back pain. But for now, thank you for listening in. Perry, thanks so much, brother, for coming in again. It's always a pleasure. Never a chore. This is like the 15th podcast we've done with him, between the Strength Matters and and now the first one with Cricket Matters. So there you go. So really appreciate your time. And until next time, guys, as we say here in Wales, ciao for now, as I say in Llandau.